From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning and welcome to Medical Forum. I'm your host, Jeff Reed. I'm here with our special guest, Dr. Chris Mahr from Columbia.
Jeff, how you
Family
been?
Practice.
How you
I've
doing?
been good.
Yeah?
I've been good. The weather's been, a little rainy.
Yeah, a little rainy. Starting to warm up a bit.
Well, we're starting to head into the summer months, right?
Absolutely. Be 100 degrees before we know it.
Yeah. So this is Medical Forum. We come to you every Saturday morning from 10 to 11. If you missed that, we also have a repeat on Sunday 2 to 3. Talk about all medical issues. Try to bring content and talk about very popular symptoms, illnesses, whatever, in South Carolina especially. But sometimes we talk about things like medical conventions or things with Palmetto Health and things that are going on. But today and in May is National Stroke Month. Chris, did you know that?
Yeah, I did not.
Did you give me anything?
Until you called me the other day. No, I didn't. Yeah, I'm gonna get you some samples of some aspirin. How's that?
Awesome.
That's probably what.
Awesome.
Probably.
Well, Sumter is and I learned this the other day. I might educate you on one thing, then you're going to take over and educate the audience today. On stroke, we talk about the stroke belt. Are you familiar with that?
I am not.
All right. The stroke belt, for those of you listening out there, Alabama, Georgia, Indiana, Kentucky, South Carolina, North Carolina, Tennessee, Virginia, and Louisiana. And check this out, since we're in good old Sumter, South Carolina. South Carolina is considered the belt buckle.
Really?
That's how bad it is.
High incidence.
So we are talking up to people here. We'll talk about here. Of course, we talk every day here in Sumter, South Carolina, but we also touch Florence. We touch Manning, Bishopville, parts of Columbia as well. So we'll talk about some stats later on. But let's get right to it, Dr. Chris. Stroke. What is it? What's a stroke?
So a stroke is when there's an interruption of blood flow to an area of the brain,
okay,
or bleeding into the brain, which causes damage to the brain tissue. Stroke is a big deal. Stroke is a big deal for so many reasons. One, it's the 5th leading cause of death in America. It's the leading cause of adult disability. So thinking about this, not only do we have a lot of people die from this disorder, but it leaves a lot of people with significant amount of disability and oftentimes incapacitated. So to the point where they may have difficulty walking, difficulty feeding themselves, difficulty dressing. They may lose the ability to drive, losing vision, and all of those things can cause disability to the point where they may no longer be able to work. They may no longer be able to care for themselves, and some patients require institutionalization or 24/7 care.
Going back, you talked about it's a lack of blood supply to the brain. Is that?
Yeah, so a stroke happens when blood flow to an area of the brain is cut off. Okay? So brain cells are deprived of oxygen and then begin to die. So it's very similar to if you understand the issue of a heart attack.
Well, talk to me, because that's what my question was going to be. What's the difference between a heart attack and a stroke in its medical terminology?
The heart and the brain are supplied by blood vessels, arteries. These blood vessels, this is all a plumbing issue, okay? So these blood vessels supply blood to the heart, they supply blood to the brain. The heart and the brain are very sensitive to blood flow, and the reason is for oxygen and nutrients to bathe these organs for them to function. So if there's anything that disrupts the blood flow, i.e. a blockage or a rupture of that blood vessel, then the areas downstream of that artery become ischemic, or they lack the nutrients and oxygen they need to keep the organ working. Okay. So a stroke can cause all of the things that we talked about, permanent loss of speech, movement, memory. There are several different types of strokes. Okay.
Well, let's talk about that.
Okay.
What are the different types of strokes?
Well, the first type of stroke is called a hemorrhagic stroke. Okay. Hemorrhagic strokes are a little bit less common. About 15% of strokes are hemorrhagic, but they're responsible for 40% of stroke deaths. So if you think about that, they only encompass 15%, but 40% of those patients are going to die. So if you did the numbers, these are a much more lethal form of a stroke.
Okay. What's number 2?
The other one is ischemic. So sticking with the hemorrhagic stroke just for a second, this is caused by like a brain aneurysm, okay? A little bubble that forms in the blood vessel. We can become weakened. The lining of the blood vessel can weaken. And then what happens is blood spills into and around this blood vessel into the brain and causes swelling and pressure. So the blood vessel swells, the walls thin, and it ruptures. And of course, this blood in the brain tissue area damages the cells and tissues of the brain. Okay? And just for terminology, there's two types of hemorrhagic strokes. One is intracerebral, which it bleeds into the brain tissue, and one is subarachnoid, and that bleeds into a space, a space that we all have where our cerebral spinal fluid hangs out in the brain. Okay. So the other type, we talked about hemorrhagic, the other type is ischemic stroke. This occurs when blood vessels carrying blood to the brain, like we said, it's a plumbing issue, are blocked by a blood clot. So going back to heart attacks, the most common cause of a heart attack is a blocked vessel, right, where we get plaque. Okay, this can come from high cholesterol and things like that. We're going to talk about later. Okay. But just like that blockage in and around the heart, you get the blockage in and around the blood vessels of the brain. And this causes the blood to not flow past that clot, and therefore the downstream tissue is not being bathed in the blood. Okay? So high pressure is the most important risk factor, high blood pressure. Pressure. Okay. Ischemic strokes account for 87% of all strokes, and they can occur in two different ways. One is an embolic stroke, where the blood clot plaque fragment forms somewhere else in the body. It can form in the heart. We're going to talk about atrial fibrillation later. Very important cause for stroke. So the blood clot forms in the heart, right? And then travels up through the neck into the brain and causes the stroke, right? And then there's the thrombotic stroke, which this is caused by a blood clot that forms inside one of the arteries in the brain tissue itself, okay? So embolic and thrombotic. Again, these are the major sources of stroke. You can have strokes in very large vessels and very small vessels. Obviously, the larger the blood vessel that gets occluded, the more damage that's associated.
He is Dr. Chris Mahr with Colonial Practice. We're coming up on our first break. I want to thank Reliable Medical Equipment. Go see them on 246 Broad Street. Phone number 934-9212, or check them out in Manning on Rigby Street as well. Dr. Mahr, when we come back, this is big. I mean, we are talking about National Stroke Month, and we are the belt buckle of the stroke belt region. So we'll be right back after these brief messages.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house, or have insurance or legal questions, or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927. 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey. Also, you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org. This is Medical Forum, presented by At Your Service Home Care.
We're back. It's Medical Forum. I'm your host, Jeff Reed. We're here with Dr. Chris Mahr. And when we left, we were talking about stroke. This is May, and it is Stroke Awareness Month. And when we left, Chris, we were talking about hemorrhagic and ischemic, the two types of strokes that are out there.
Yeah, the things to remember about that, again, are most common cause of stroke is the ischemic stroke. The hemorrhagic is the more lethal form of stroke.
Gotcha. How do we know? How do we know we're having one?
Really important because early intervention, the quicker we recognize the symptoms, the quicker we get treatment, the better off we're going to do, right? So each year, about 185,000 people die from a stroke. Fairly has a pretty big impact.
Well, you just said it was fifth killer.
What did I say? Fourth? Yeah, fourth or fifth. Yep.
Yeah. And I think heart attack always will take over, but cancer and all that. But yeah, so it's a biggie.
Yep.
Let's just put it that way.
Yep.
It's a biggie.
And again, early recognition. So knowing the signs and symptoms of stroke is just the first step to ensuring, you receive quick, timely medical help. I mean, this is not something to sit around the house and figure out if you've got a stroke. This is not call my insurance nurse line and talk to her for 10 minutes about what I'm doing. This is
to the ER.
Gotcha. If you can get to the ER by having someone drive you, drive. If not, call 911. Get to the hospital as soon as possible. Of course, I always advocate 911 transport. If something happens while you're en route, they're going to be able to manage you a little bit.
Well, last thing you want to do is get out there and have it really hit it.
Never drive yourself.
Yeah.
Call 911.
Right.
Get to the emergency room right away.
How do I know if I'm having a stroke?
Well, let's talk about that a little bit. Each minute that you've got these symptoms, right, and it goes on, untreated, blood flow to the brain continues to be blocked, right? So a person loses, I think actually, Jeff, you had popped this up, 1.9 million neurons.
But only a minute. Every minute.
Exactly.
I don't even know if I started with that
this could
many,
mean
Chris.
that a patient's speech, movement, memory are affected. So, we want to learn as many of the symptoms of stroke that we can. But a lot of the symptoms, we need to know kind of how they play out. Not just what the symptoms are, but how they play out. The symptoms are sudden. Okay, so it's not something that you've had a tingling in your finger for a month or so and it's getting a little bit worse. Right. That is typically not a stroke. Could it be? Yes, but typically not. But the symptoms are typically sudden. Numbness or weakness in the face, arm, or leg, especially on one side of the body. Okay. Sudden confusion, trouble speaking or understanding. Okay. Sudden trouble seeing in one or both eyes. Okay. Sudden difficulty walking, dizziness, loss of balance or coordination, and then finally sudden severe headache with no known cause. So again, the common factor for all of those was sudden. Right?
Yeah, because I think the listeners out there are sitting there going, "Gosh, I got a headache. Am I having a stroke? Oh my gosh, I'm slurred. I can't remember what I'm saying or whatever. Am I having a stroke?" But question: if I have one of these, now, we've all had a headache. Right? Mm-hmm. So if I came in and said, I'm going to the emergency room, what's the matter? I have a headache. Probably I'm going to get looked at like, and why are you here?
Well,
take 2 aspirin, call me in the morning.
As a physician, we've always been taught to ask the question, is this, how bad is this headache?
Is it typical?
And the patient that says, this is the worst headache of my life, needs to be taken seriously.
All right.
So if you get an abrupt onset of the worst headache of your life, you need to go to the emergency room. I'll tell you a really interesting case. I saw a patient 2 weeks ago. He was playing an outdoor game, let's say cornhole or something to that effect. Bumps his head. This is a little bit elderly patient. Bumps his head on a tree limb. Okay, not real bad. Didn't think anything of it. Finished the game. Started getting a headache an hour later. Headache. Worse. Not getting better. Took some Tylenol, not getting better. Goes to the emergency room. Had a hemorrhagic stroke.
Did one cause it, or did the hitting his head actually maybe save his life because there were symptoms were already there, and that's what took him there?
Who knows?
Yeah.
Who knows? But I have seen patients, especially elderly patients, suffer very mild head injuries and develop bleeding in the brain. Okay. So there are lots of risk factors. The older you are, the greater your risk for bleeding in the brain. Use of medications like aspirin increase your risk of bleeding, so that increases your risk for bleeding in the brain. We use so many anticoagulants now for people with blood clots and pulmonary embolus and AFib and all this. Those increase your risk for bleeding in the brain. So again, elderly patients bump their head, headache, something like that's not getting better. Be very sensitive. Go to the hospital. Have it checked out.
All right. In my little studies, go ahead, Chris.
No. So the next thing is kind of a public service message. I think I would be negligent and not talking about the fast.
That's where I was going. So you read my mind, babe.
So kind of a summation of what we've talked about. To remember, this mnemonic is called FAST, F-A-S-T, and truly any of these symptoms you need to call 911. F stands for face drooping. Does one side of your face droop, or is it numb? Mm-hmm. Ask the person to smile. Is the smile uneven? Just and as an example. Mm-hmm. A stands for arm weakness. Is one arm weak or numb? And again, what was the common denominator for everything? Sudden onset, right? Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S of fast refers to speech difficulty. Is the speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence like, the sky is blue. And can they repeat that sentence fluidly and understandably? And then T is time, and we talked about this. The longer this goes on, the more brain cells you're killing.
2 million brain cells, basically. Rounding it off.
That's impressive.
Yeah.
So time to call 911 if someone shows any of these symptoms. Even if the symptoms go away, call 911 and get the person to the hospital immediately. Check the time so you know when the onset of symptoms appeared. Really important, if you can write down the time when the symptoms appear, that is a tremendous amount of information to the medical staff.
So if I'm thinking that a patient of mine is in my office and I feel like I see those symptoms, the fast symptoms you talked about, it's very important that if I do call 911 or take him to the emergency room, do it as fast as possible, obviously.
Yeah.
Is to also document when I've at least noticed these things happen.
Yeah.
Because
so if they've been going on a few minutes, maybe knock 5 minutes off, but write that number down on a piece of paper, stick it in your pocket, and take it with you to the emergency room. This will really provide a lot of information to the medical staff.
And I think as we come up on the end of the second segment, we're going to talk about why. And we're also going to talk about a symptom that's out there that kind of disguises itself as stroke. It gets people thinking same symptoms, but I feel better now. And we'll come back and we'll talk about, we'll just make that our little teaser as we go to break here. I want to thank At Your Service Home Care, always great sponsor of the show. For any need at home, dad doesn't want to go to nursing home, give them a call, 607-9677. Take great care of them. Wonderful CNAs right there on 1250 Wilson Hall Road. And we'll be back. We're talking about strokes with Dr. Chris Mahr.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports, WDXY 1240 AM and 105.9 FM.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey, all so you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation. 607-9677.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
This is Medical Forum, presented by At Your Service Home Care.
And we're back, Medical Forum, on this Saturday morning. I want to thank our guest, Chris Mahr, for dropping by. And it's National Stroke Month, so that should be a great topic for this month. We come to you every morning on Saturday mornings from 10 to 11. Also, check us out if you miss any of the show or want to catch it again. Sunday, we repeat the show Sunday 2 to 3. When we left, we've been talking about stroke, obviously. That's the theme of today's show. And we're talking about the different types of strokes. And we're talking about some of the symptoms and signs that will allow us to think about stroke and say, wow, is this something that's happening? And Chris, a word that always comes into my office is TIA. I see it so many times as a diagnosis, and it's kind of a pseudo-stroke. I'm going to give my layman terms. I want you to give me the medical terminology, but it kind of disguises itself as a stroke, and it is serious. But it seems like, because one of the things we're trying to emphasize to everyone is if it suddenly comes upon you, if it's suddenly and to act immediately, 2 million brain cells for every minute that we decide to delay and contemplate whether this TIA.
So
What's
TIA
that?
stands for transient ischemic attack. So let's go back to what we're talking about with a stroke and ischemic.
My grandma called it a spell, by the way.
Spell, absolutely. And the reason it's described as a spell is because it's a stroke-like attack that typically resolves within minutes, right? But when the attack is occurring, it's indistinguishable from a stroke. So if you're standing in front of a doctor and having a TIA, no one can distinguish the difference between a stroke and a TIA until the symptoms have resolved. Once the symptoms have resolved, then you can label something a transient ischemic attack. So you can perform imaging of the brain like an MRI, and that'll tell us the difference between a stroke and a TIA in a short period of time. Mm-hmm. CAT scans can often take longer to determine whether someone's had a stroke. But if you're having the symptoms and you're being examined at that moment, it's indistinguishable. So resolution is what determines that is a TIA versus a stroke. And so what happens is you've got that clot that's hanging out in the brain, right?
Does a TIA have a clot?
Yeah,
I know the symptoms are there, but is the problem causing it the same? Probably
plaque in the artery. Okay, and so you're getting a restriction of blood flow that opens itself up and allows blood flow to finally be restored, and then the symptoms resolve. TIAs could be. This is the important thing. Is a TIA is a warning sign for a stroke later in life. So if you have a TIA, your risk for stroke is higher than a person who's never had a TIA. Okay. So what is important is that this is a risk factor and that it needs to be treated. So if you have a TIA, one, you need to be in the emergency room. It needs to be deemed TIA versus a stroke. And after you've been sent home from the emergency room with the diagnosis of a TIA, you need to follow up with your physician, talk to them about risk factor reduction, and
gotcha.
How to prevent the stroke.
Well, you just hit on risk factors. Let's just get it out. If I smoke, I am going to obviously heighten my chance.
Absolutely.
Which I think we've done, 60 shows?
Yeah.
And smoking, I think we've come to one conclusion. Unless you own the company that sells cigarettes, it's probably not good for you. Everybody else loses.
Right. Absolutely. There is nothing good about it. So let's talk about cigarette smoking. Smoking doubles the risk of a stroke when compared to a non-smoker.
That's insane. Let me give you a stat real quick.
Double.
Do you know how many people smoke in South Carolina? 20.8% of the people in South Carolina smoke.
Wow.
Now think about that.
That's amazing.
Yeah. Well, I think they start young. Here's the bottom line, guys. Anyone listening out there is maybe 18 or 15 or whenever you start smoking. I can't think of anything, and we'll talk about heroin use, and we've had it's very difficult to stop.
Yeah, absolutely.
Once you start that nicotine, so once you say, I'll smoke when I drink, I'll smoke to be cool when I'm 18, and not to get off on a tangent because we'll get right back to stroke, but it eventually heightens your chance 50%.
There was actually a study I read a couple of years ago, and I don't know if I'm not going to quote it directly, but it was a study that showed that even a very small amount of smoking in a lifetime, meaning I think it was 1 pack per day for a year, right? Which, if you've smoked any in your life and you smoke for 2 or 3 years, even if you're a light smoker, that you probably fall into that category. It increases your risk for certain vascular diseases, specifically like abdominal aortic aneurysm, which is a life-threatening condition, dramatically. And I want to say that the number was 10%. I'll see if I can find the number during the break. But my point being is it doesn't take much. The nicotine is directly toxic to the lining of the blood vessels. And we talk about stroke, we talk about heart attack, we talk about erectile dysfunction, we talk about peripheral vascular disease, kidney disease. It's all the same. It's plumbing
Chris,
in your body.
It makes me thinner. Right? And how many women out there won't stop smoking because
or weight gain
they'll weight gain.
Stuff. Absolutely.
Come on, man. Let's get on a treadmill.
So, smoking increases the risk of clot formation. It thickens the blood and increases the amount of plaque buildup in the arteries. If you smoke, you just got to try to stop. There's lots of things. There's lots of techniques out there.
How about diabetes?
Absolutely.
Because this is a huge diabetes neck of the woods here.
Yep. So the risk factors that are non-lifestyle. So you're jumping to the medical risk factors. I want to get back to lifestyle for a second.
I'll go to lifestyle.
But the medical risk factors are high blood pressure. Okay, the number one cause of stroke. Number one. This is a medical risk factor. Blood pressure is the force pushing against the walls of the arteries. So the more force, the greater the force that's exerted on the walls of the arteries is going to damage the lining, the endothelium of the blood vessels. So high blood pressure causes the heart to pump harder, move blood through the body, and then, of course, this weakens the blood vessels. So people who have high blood pressure have 1.5 times the risk of having a stroke compared to those who have optimal blood pressure. And what's optimal blood pressure? 120/80, right?
Right.
Diabetes, Jeff, you talked about that. Absolutely. People who have diabetes either don't produce enough insulin. We've talked about all of that. Or they produce plenty of insulin and their bodies are resistant, right? So people with diabetes are up to 4 times more likely to have a stroke than people who don't, mainly because people with diabetes, have other stroke risk factors like high blood pressure, atrial fibrillation, high cholesterol, weight loss, exercise, changing in eating habits. Those are the important things. Carotid artery disease. This is the buildup of plaque in the carotid arteries of the neck, also called carotid artery stenosis, narrowing of the carotid arteries. The carotid are the two main blood vessels in the neck. There's oftentimes this is an asymptomatic disease. It's often picked up during a routine physical exam by your physician. And I'm going to hold off on there until we come back from the break.
Good. Dr. Christopher Mahr. You can check him out on Colonial Family Practice, of course. Phone number 774-8245 right there on 698 Baltman Drive. Nice parking, by the way.
Yeah, great,
people can come see
new
you.
location. We've been there about 8 months.
Yeah.
Back with more on Medical
easy
Forum,
access,
presented
lots of
by
parking,
At Your
big
Service
waiting room.
Home Care.
Good deal.
Come in and see us.
We'll be right back.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927. 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey. All so you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation. 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
Oh, welcome back on this Saturday morning. Got Dr. Christopher Mahr in here. Christopher, when we were leaving this, we're talking about lifestyle, risk factors, and we're talking about stroke. And obviously we hit on cigarettes. Give some of the other things that we need to from a lifestyle standpoint. I assume obesity can't be good.
I want to divide things up so it's easier to understand. There's two sets of risk factors, and we call them kind of modifiable and non-modifiable. Even though we can control our diabetes, even though we can control our hypertension, we call those non-modifiable because they're truly medical conditions. But the lifestyle risk factors, which we consider modifiable, they're just so important. Number one, we already talked about cigarette smoking. I'm not going to talk about that again. Just you got to be done with it.
We know.
We know the impact. There's no excuse anymore.
Yeah.
With the public service announcements, everybody knows how bad cigarettes are. You got to stop. Go talk to your doctor. There's drugs out there that can help, like Chantix, Zyban. There's nicotine replacement systems that you can easily walk into the drugstore and get. Don't buy the cigarettes. Buy the patches. You've got to make that choice. You've got to decide you want to quit. Until that, you're going to have a difficulty. Diet and nutrition, though. Healthy diet can reduce your risk of chronic diseases, all the chronic diseases, hypertension, low sodium diet, diabetes, low carbohydrate diet. Mm-hmm. But improving your overall health can help you maintain, healthy weight. Weight is really what we're getting to. So you want to maintain that healthy weight. Eat more foods that are from plants, such as vegetables, beans. Beans are a great source of protein, high in fiber.
Any typical?
Most beans. Soybeans are great.
Green beans?
Oh, absolutely.
Okay.
Yep. Whole grains and nuts. Eat more seafood in place of red meat, poultry, and eggs. Seafood like salmon. Salmon has a high content of omega-3 fatty acids. Fantastic fish to eat. But generally speaking, all fish are good. Shellfish or crustaceans, shrimp and crab, a little bit higher in cholesterol, but still have a lot of very good proteins in them. Limit the intake of sodium. We talked about that. Sodium has a direct impact on most people's blood pressure. So not everybody is impacted by sodium, but most of us are. So a low sodium diet will lower your blood pressure, hence lower one of your greatest risk factors for stroke. Avoid solid fats, added sugars, refined grains, highly processed grains. Whole grain bread is always better than white bread. Whole grain rice is always better than white rice.
Okay.
Reduce your calories you eat and drink and increase the calories you burn through physical activity. That's our plug for Missy Reese. Get up to the Y and do it. So going on to physical activity, anything that gets your body moving. Moderate activity. I think these are some really good numbers. Patients often say, how much do I need to exercise? In the past, just go out and do stuff. But I've actually been writing down goals for patients to do. Moderate exercise is defined as 150 minutes of moderate intensity activity per week. So just brisk walking, water aerobics, bicycling, and 2 or more days a week of weight training. So really, if you think about your exercise, how much you need, right?
So about 20 minutes a day if I did it 7 days a week.
If you did it, I usually tell patients 30 minutes 5 days a week.
Gotcha.
Okay.
All right.
Now there are some different type of exercise modalities. One of the exercise modalities I've been really interested in, I've been reading about, is called HIIT. It's called high intensity interval training. And what they've done is they've actually studied HIIT programs, and they've shown that you can have greater effects with shorter workouts. So 20 to 22 minutes of exercise.
But they're intense, aren't they?
Highly intense.
So we really get the blood going.
Highly intense.
I mean, we get the heartbeat up.
Right. And so they're showing that it takes maybe less time. And all of us, most of us who are working, families and stuff, we're trying to be as efficient as possible. HIIT, or high intensity interval training, is very good.
Interesting.
Vigorous activity is considered 75 minutes of vigorous, intense activity, jogging, running, swimming, laps, and 2 or more days a week of weight training. The weight training is really important. Building muscle. One of the cool things about the greater the muscle mass you have, the more calorie expenditure you have while you're resting.
Mm-hmm.
So the more muscle you have, the more calories you're burning when you are not exercising. So that's kind of where the weight training comes in. Break it up if you can't fit it all in. It's better to do 10 or 15 minutes twice a day. I love seeing people walking at lunchtime. Go for a 15, 20-minute walk that's very brisk, and especially when it's cool out. You're not sweating tremendously. It's not like you have to hit the showers or anything.
Something's interesting, Chris, and people don't realize that you can get a lot of activity. I've got a Fitbit, and I went shopping the other day, grocery shopping, and I wasn't organized. And as I was doing it, my wife was texting me going, oh, and get this too, and get this. Yeah. And then, so I'm going up one aisle, back another aisle, 2,100 steps.
That's awesome.
For grocery shopping. Forget
that,
getting out, cleaning the house, going up and down the steps. Maybe when you go to Walmart, even though it's really crowded, when you have to park further from there, you get exercise.
Park in the last space and walk up there. Elevators and escalators, take the steps.
Yeah.
Take the steps. Yeah. Just little things like that can, and you have to think of the cumulative effect, right? So if you take the steps every day, just doing it once a day might not be a big difference, but if you're doing it 5 days a week up and down at your
times 250 days of work,
place of employment, that has a significant impact in your calorie expenditure.
How about sodas?
Well, sodas are generally high in sodium, so that's why we have to watch sodas.
And
regular sodas, sugar, diet sodas are full of artificial sweeteners like aspartame. It's a tremendous amount of aspartame or artificial sweetener. We think about drinking a cup of coffee and we might put a half a packet or a packet. A soda may have 4 or 5 of those packets in. So much.
So we can control a lot of this. Don't smoke. exercise, eat right, be a little choosier, be a label reader.
And watch your alcohol use. Okay, small amounts of alcohol, no problems. 1 drink is equal to 12 ounces of beer, 5 ounces of wine, or 1 to 1.5 ounces of liquor. Okay, so for a man, 2 drinks a day. For a woman, 1 drink a day. That should really kind of be the limits of those types of things.
I gotcha.
Okay.
Now, those were considered...
Those are the lifestyle changes.
Now, we got about a minute left in this next segment, so...
I want to talk about
let's start off.
The medical risks for stroke. And we talked a little bit about diabetes. We talked about hypertension. The one that I'm going to start talking about, because you said we only have a minute or so, we're going to go into the next
segment, though. Yeah, it'll take us
go into the next segment, is atrial fibrillation. This is a tremendous risk factor for stroke. Atrial fibrillation is a fluttering of the atria of the heart. So the heart should normally beat synchronous. The atria, top of the heart contracts, and then the bottom part of the heart, the ventricles, should contract synchronously. Atrial fibrillation is where the atria just fibrillates, just vibrates, and does not contract, meaning it really doesn't empty its contents after each contraction. Okay. This is a condition you can certainly live with. A lot of people live with, as a high, very common.
Chris, when we come back, we're going to continue to talk about atrial fibrillation, because I think that is a very, very big topic, and it needs much discussion. We'll be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house, or have insurance or legal questions, or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable medical equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter, or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
Looking for your doctor? We're pleased to announce the Toomey Medical Professionals practices became part of the Palmetto Health USC Medical Group. With 500 physicians and providers, we are working together to bring you and your family the broadest range of healthcare services in our practices and across the system, including at Palmetto Health Toomey. Also, you can get the very best care right here. To find your doctor today, visit phuscmg.org. That's phuscmg.org.
This is Medical Forum, presented by At Your Service Home Care.
We're back. We are celebrating, I guess, if you want to call it. May is National Stroke Month. We got Dr. Chris Mahr from Colonial Family Practice over on Baltman, 774-8245. Stop by and see him. Chris, when we left, I had to cut you off for a quick break, and we were talking about atrial fibrillation and how its little part was stroke.
Yeah, so atrial fibrillation, again, you're not getting a full contraction of the atria, and therefore blood remains a bit stagnant in the atria. And what this can cause are blood clots. Okay, so a blood clot can form in the heart. And then we talked about that type of ischemic stroke, 2 types, hemorrhagic and embolic. Mm-hmm. And then The embolic stroke is where that blood clot that forms in the atria of the heart gets pumped into the brain, right? And so that's a big deal. I mean, because that's going to occlude the blood vessels of the brain and cause that problem. Signs and symptoms of atrial fibrillation. Usually, your doctor's going to pick up on atrial fibrillation by feeling your heart or listening to the heart or doing the EKG. That's how it's diagnosed. The symptoms can be very subtle.
Let's say I have it.
Yeah.
How do you help me?
So some patients will just come to the office and say, I'm a little bit tired. I get short of breath with activity, or maybe even short of breath at rest. And then some patients will come and say, my heart's beating funny, and that's how we pick up on it. Usually though, atrial fibrillation patients are a little bit tachycardic, meaning their heart rate is fast, over 100. That's how most patients present, and so oftentimes they present to the emergency room with atrial fibrillation. There's risk factors for atrial fibrillation.
What do we do for
alcohol?
What do we do for it?
So once it's diagnosed, if the rate is fast, patient often needs to be admitted to the hospital. They control the rate and they bring it down. But majority of patients, especially if you're of a certain age and you have risk factors for stroke like diabetes and hypertension and things of that nature, and there's criteria we follow, most patients need to be on blood thinners.
Okay.
And usually aspirin is not adequate alone. Okay. Usually blood thinners that thin the blood, things like Coumadin and Xarelto and Eliquis and a couple of Pradaxa, lots of different blood thinners, but these significantly reduce the risk of stroke. And it's very important that patients are absolutely compliant. And I've had patients we've put on these blood thinners and they come back 6 months later and I say, you taking this. Well, no, I stopped my blood thinner. Why'd you stop your blood thinner? Well, it was expensive. I didn't like it. I did this and that. Made my arms bruise or something like that. So those are all problems that need to be combated, need to be, tried to resolve. But it's absolutely necessary for patients to be on the blood thinner for the duration of the time they have atrial fibrillation. Yeah. There are some treatments for atrial fibrillation where they can shock the heart to restore its sinus rhythm. They haven't really shown a lot of improvement in mortality and how long people live if that choice is chosen. There's some medications that can be used. There are catheter ablation techniques that can be done. Again, these can be discussed with your doctor, but just if you have atrial fibrillation, the rate needs to be controlled and you need to be on a blood thinner. Huge, huge risk factor for stroke.
Let me tell you, because we want to talk about the treatments as we come up on this last segment. I want to give you a little stat, Curtis. 1999, 150 people died, stroke mortality rate by county. So it's age adjusted. What you get off the website is what you get off. So we'll read that. 150, 61 in 2008 and falling. Question. I had this stroke. What are my treatments? So let's just say I've noticed it. I've listened to you. I guess I haven't listened to you on the front end because I've maybe not had the warning signs, and we won't get into genetics, but we'll assume genetics plays a role. It does generally in everything else. I've got to the hospital. What do I anticipate when I go into that emergency room as far as my treatment?
So one of the things that we talked about earlier was the timing of the stroke, and I had mentioned that if you feel like you're experiencing a stroke or you're with somebody who is, write that time down and carry that time with you so that the medical staff has a good idea of how long the stroke has been occurring, right? So based off of that time frame, there are different options for treatment. If you are way past the time frames for the treatment, oftentimes the treatment is nothing more than maybe an aspirin and admission and watching.
So if I'm listening to this and I'm sitting home and I feel those treatments come up, you're not recommending somebody just go take an aspirin and because we don't know what the severity.
Absolutely not.
Right. So, but it may be once it's detected and all the tests have been run.
Absolutely.
Yeah. Okay.
So the symptoms occur. Write down the time, make note of the time, and get to the emergency room. There are a couple of advanced techniques that can be done. Number one, there is a medication called clot busters.
Okay.
TPA, These are medicines that they give you through an IV that break up clots. So you have the little clot in your brain, just like the plumbing in your toilet that you would put a clot buster in to break that clot up. Okay. You have a clot in the brain, and that medication can be administered to break up the clot in the brain and restore blood flow downstream. Okay, that's one option. Another option that's typically done at a tertiary facility, an academic facility. I do not think that this procedure is done in locally in Sumter. I could be wrong, but I'm not sure. But Richland, MUSC, they can insert catheters into the areas and squirt the medicine right where the blockage is. Of course, these are fantastic procedures. Yeah. They have to be done by highly, highly trained, highly skilled, typically radiologists, neuroradiologists.
They don't do it externally. They go in like a catheter
up through into the brain and inject the medication directly where the clot is. Amazing stuff. And that's really it. Those are it. And again, if you're out of the time frame for either of those two treatments, then your treatment is supportive, watching, admission, watching the person, aspirin, and just, hoping for the best.
Chris, we're coming up. We got about a minute left. It is May is National Stroke Awareness Week. We've learned a lot. Can you summarize it in 45 seconds?
So remember the risk factors, so important. Modifiable versus non-modifiable. Reduce alcohol consumption. Stop smoking. Get exercise. Eat a healthy diet. Medical, keep your blood pressure controlled. Diabetes controlled. Remember the FAST. Mnemonic. Look for F, face drooping. A, arm weakness. S, speech difficulty. Symptoms are typically abrupt in onset, and call 911.
And what I've learned today, sudden. So when it happens, sudden don't sit and ask why. You need to react. Chris, as always, have a great weekend. Have the rest of your weekend.
That's right.
And we'll see you next week.
Thanks, Jim.
All right. Thank you. Thanks for everybody listening to Medical Forum. And we'll be back next week.